All right, back to it now. Thank you for being here as we get back into the conversation. My next guest, Dr. Mollie James, runs the James Clinic, board-certified general surgery, critical care medicine, and now on the board of Americans for Health Freedom. Plus, she's building a new clinic in Southeast Michigan. We'll get to that in just a moment, but here she is. Dr. James, welcome to the program. Welcome back.
Good morning, Steve. Thanks for having me.
Good to have you. I see you're in a construction zone, and we will talk about that in just a moment. But first, Americans for Health Freedom. You were one of the voices out there during the pandemic saying, look, you can't do this to us, you can't do that to us. We have rights as Americans and as patients in the medical system. What is Americans for Health Freedom, and why is it so important?
Yeah, for anyone who follows Dr. Mary Talley Bowden, she's been very active in talking about the politicians who have come forward and said we need to pull the mRNA shots off the market. And she was posting those, and that grew into a movement. So now there's a Health Freedom PAC. It's americansforhealthfreedom.org. And the whole premise for this is find those politicians and candidates who make a commitment to pull the mRNA shots off the market. There's some other things that I think we need to take care of as well regarding the WHO, but that is the commitment, that's the charge. There is a list on the website. So if you don't know who you're voting for, you want to go to americansforhealthfreedom.org. There's a list of politicians in office currently, and there's also a list of candidates who are running in the next election. So if you know anybody who believes in this and wants to be listed, they can message me, they can message Dr. Mary Talley Bowden or one of the other board of directors.
Well, when you talk about the mRNA injection, look, there's no question that we've seen the all mortality figures that went up, not during the pandemic originally, but when those shots were rolled out in different countries, the all mortality statistics, they spiked. Pretty obvious in the numbers, isn't it?
All-cause mortality, and the problem is we're seeing it in younger patients. We're seeing it in the 18 to 49 category, not the 80 and above that we saw during COVID. So this is indisputable. It's higher in countries who went forward with the mRNA shots. And, you know, it's followed by other things like increasing rates in cancer. The American Cancer Society just came out with that, and there's two interpretations. You know, the folks who are in my movement who believe in health freedom are pointing out that these cancer rates are going up explosively, especially in younger patients. So
yeah,
it's indisputable once you look at it.
It is, and I want to go back to, you mentioned the World Health Organization. This is an organization, I don't know if they have a lot to do with health, but they have a lot to do with control and power, because they want all the control and all the power to come in and dictate to countries if they say there's a pandemic, if they say there's an outbreak of disease X, as they like to call it at Davos or whatever. They want the power to come in and dictate to countries, our country, to our citizens, what happens next. And that's why it's so important that Americans for Health Freedom is here to tell you, here's a candidate that might agree with that. Here's a candidate that does not agree with that. That's critical to know, isn't it?
This is really important as we go forward. The abuse of powers that we saw during COVID are only going to be expanded if we join the World Health Organization and their pandemic health treaty that they're trying to pass. That's coming for a vote this May. If you haven't heard of that, if you don't know about that, you need to go look it up. My colleague Kat Lindley, Dr. Kat Lindley, has been reporting on this. She has contacts all around the world, and she reports on who is against this, you know, what is going on, what's behind the scenes. So she's a great source of information for that.
Let me ask you this. If somebody had the mRNA injections, 1, 2, 3, whatever it might have been, I heard Megyn Kelly talking about this the other day. She had 3 because in order to survive in New York City, you're required to do that, basically. They forced people into getting it. But how do you deal with somebody now? It's 2 years or maybe 3 years on since people got the jab. Are they out of the woods? Is there more to be concerned with? Is there something that can be done to help them at this stage in the game?
There's kind of 2 categories of patients that we see. One of the categories that's clearly vaccine injured. They developed symptoms that nobody knew how to fix after they got their shots. We have a great treatment roadmap for them. I won't call it a protocol because we do individualize it for each patient. And then there are patients who reach out to us and say, geez, I see all these people who don't wake up in the morning and I want to know if I'm at risk. And the answer I have for them is I will work you up, but we don't know because these weren't tested for safety. We don't know long term. I don't know if you show inflammatory markers and we treat you properly, if that's going to reduce your risk over time. So we use our best guess and judgment to move forward for them.
Yeah. And meanwhile, Pfizer minted, what, 16 new billionaires along the way, just as an example of how much money was flying around. All right, let's talk a moment about the construction zone you're in, because you're taking a new path in medicine. You're trying to help people you're trying to actually practice medicine, unlike a lot of the big companies that just want to, cash the cash register. What are you building there in Southeast Michigan? What is your facility going to offer?
This is one of our flagship locations. It's our biggest clinic. It's bigger than all three combined. We are going into partnership with the Living Springs. This is 5,200 square feet right here in Detroit, 22nd and Van Dyke. We were studs on Friday, so it is miraculous. Already miracles are happening in this place. But what you're going to have is you're going to have the James Clinic Medicine on one side, and you're going to have the Living Springs, every wellness treatment you can imagine on the other side. So we have the IV vitamin infusions, we have ozone, EGU, PRP. We are going to be a true dose PRP center of excellence. Then you have on their side hyperbaric oxygen, the cryotherapy, infrared sauna, red light therapy, the Hocket, which is an ozone sauna. It's going to be unbelievable, Steve.
Okay, so it's the James Clinic in Detroit, but as you mentioned, you have other locations around the country, because I'm sure people listening are going, hey, I'd like to know more about what she's up to. Where else are you located? Where else do you offer services?
We're currently in the western suburbs of St. Louis, in southern Iowa, my hometown of Sheraton, and then we are opening in North Carolina, Troy, North Carolina, April 1st. So we're expanding rapidly.
So the James Clinic is on the move for sure. And something else that you've been working with us on is original broadcasting, original content programming that you've been putting together, and people can find it at the Steve Gruber Show. They can find out information, thestevegrubershow.com, but they can also find it at thejamesclinic.com. Tell us about your weekend programming. What do you try to share with people? What do you try to help them with?
Yes, it's called Uncensored with Dr. Mollie, and basically what I want to do is bring you information. All week long, we see news, we see health reports, and what I do is I break it down to the truth that you trust. We cover things like controversial drugs like semaglutide. I covered, recently I had Dr. Pete Chambers on. We covered what's happening with the convoy at the southern border, and what he's been doing, the military side of things. So it's very practical information. It's medicine, politics, and current events, and that's what we cover.
So, Mr. Chambers, the guy that was on Tucker after that, is what you're telling me, right?
Yeah, Dr. Pete Chambers, he's one of the leaders of the convoy, the peaceful convoy down on the southern border, and he was on with us on Sunday, and then I saw him on Tucker Carlson a few days later, so I was very proud of that one. I'm very fortunate and blessed to have colleagues who are movers and shakers in the country.
Well, you do. You have contact. I mean, obviously, big names. If you're getting them before Tucker, you're doing something right, that's for sure. Dr. Mollie James, you can find out more at jamesclinic.com about what she's talking about for treatments, to deal with all of the specialty things she has in St. Louis or Detroit or North Carolina. It's going to be available everywhere, jamesclinic.com. Dr. Mollie James, thank you for being here and being, I suppose, a ray of hope for a lot of folks. Thank you.
Thanks, Steve.
Really appreciate it. There you have it. JamesClinic.com if you want to find out more about Dr. Mollie James. She is a fascinating individual. Also, WJIM.com, WJIM, that's Jim, WJIM.com to find her weekend programming, Uncensored, with Doc Mollie. All right, there you have it. Good stuff. I'll be right back.